Welcome to the Forsyth Magazines podcast. I'm your host, Brooke Culler, bringing you the stories of the people shaping our community. From business owners to local leaders, we'll explore their journeys, passions, and lessons learned. Let's dive in. Hey guys, we are back with another podcast episode, and today I have Dr. Bastawros. She is a urogynecology provider at Novant Pelvic Health Center in Winston-Salem. Hey there, how you doing?
I'm doing well, Brooke. Thank you for having me here today.
Yeah.
I'm excited to talk about all things bladder.
Oh yeah, let's do it. I know this is your first podcast episode, and we're so excited that we can be your first one. So Dr. Bastawros, 100 million people in the U.S., it sounds like, live with urinary incontinence, and that's obviously a huge problem.
Mm-hmm.
I know there's a lot of embarrassment around it. People are living with symptoms due to embarrassment or due to just thinking that it's part of getting older. So I kind of want to talk about that and talk about when you need to go to a provider.
Mm-hmm. And that's all great. It is only going to get worse. There's going to be more and more men and women who are suffering from incontinence, and with all the information out there on social media now, people are being empowered to look for treatment, but many people may not know where to go.
Yeah.
Just to put it into perspective, about 1 in 20 women are going to undergo some sort of surgical procedure for incontinence in their lifetime. So it's important to get an idea what to do now, not wait until the problem develops.
Yeah.
So you can lower your risk and just live a happy, dry life.
Yeah. So let's back up a little bit. I want you to tell our listeners what exactly is a urogynecologist, because I don't know. I'm acting like I do, but I don't.
And it can be pretty confusing. When you hear a urogynecologist, you're like, okay, are you a urologist? Are you a gynecologist? What exactly do you see and do? So a urogynecologist is a subspecialist who focuses on urinary incontinence disorders, fecal incontinence, pelvic organ prolapse, and other pelvic support disorders as well.
Okay, gotcha. So two common terms I hear a lot are overactive bladder, and then you hear about stress urinary incontinence. What is the difference between those two?
So that's a great question, because a lot of times women will come in and just say, hey, I'm leaking, but they're like, I don't know what it's from. I'm just leaking.
I feel like a lot of times women, especially obviously just women, will blame it on having kids.
Correct.
Yeah.
Correct. And that is a big risk factor. To answer your question about the difference between the two, so stress incontinence is that urine leakage whenever there's a sudden force on the bladder. So, for example, if you're laughing or coughing or sneezing or doing jumping jacks or running.
Say, at the gym, the women, it's like a joke when you're doing jump rope. It's like, we got to go to the bathroom first.
Exactly. Yeah. Exactly. So that type of leakage happens primarily due to muscular weakness. So that's why things like medications won't necessarily help with that type of incontinence, because we have to physically resupport the urethra, or that tube that you urinate from. Whereas overactive bladder, that's more that urgency, that frequency, that I gotta go, I can't make it to the bathroom. And that's more related to a sensory miscommunication, essentially, between the brain and the bladder. And that's where things like medications come into play. So they're both causing incontinence, but they're both caused by very different mechanisms and therefore treated very differently from one another.
And so both of these conditions are obviously happen in women and men. Is that correct?
Correct.
So I feel like for the men listening, do you guys treat men as well?
In our office, we do. So me as a urogynecologist, I primarily treat women. That's where my training is. Okay. But one of my partners is a urologist who addresses men with incontinence. And men can have both stress and overactive bladder.
Okay.
Well, how do you know which one of those is happening? Whether it's the overactive bladder or
the
stress part.
Yeah.
If you don't know, what can you look for that might indicate, oh, I need to change that? Not just I drank a lot of water today and I've got to go to the bathroom a lot.
Yeah. So, for example, when the leakage happens, I always ask my patients this whenever we're trying to go through their history and try and figure out, okay, which is it? Because it's very common to have both, and there's a lot of overlap between both as well. So I always ask my patients, okay, when the leakage happens, did you have an urge right before it happened? And if so, then that's an indication, hey, it's most likely related to that urge incontinence or overactive bladder. Versus the women who are like, nope, every time I leak, it's only when I run, or it's only when I cough. And I never have any leakage when I have the urge. Then that's an indication, hey, maybe it's more stress related.
Okay, that makes sense. So is there anything that we can do like at any age to kind of like lower the risk of this happening?
Absolutely.
Yeah.
Absolutely. And this is what I'm loving right now about the digital age of information, is that there's a lot of information out there about pelvic floor physical therapy. And that's one of the best things that young women can do to lower their chances of incontinence, but also pelvic organ prolapse once they hit the menopausal age range. So for all the young mothers out there, or women who have just given birth, getting into pelvic floor therapy to rehab that core and rehab that pelvic floor is one of the best things you can do. Other core-centric exercises like Pilates or yoga, throughout your life is a great way to maintain your pelvic floor strength.
Mm-hmm.
Doing a lot of bladder retraining techniques, so working on isolating your Kegels and strengthening those muscles, and then learning how to take it to the next step. So what that means is, if you have the urge to go to the bathroom, do a Kegel, strengthen those muscles, and just hold that muscle tight until that urge goes away. And the more you do that, the more you're training your bladder not to give in to that urge and essentially lowering your threshold.
Yeah. I saw somewhere online, which I'm sure you hear this all the time. I read an article, which means I saw a TikTok video, that you're, that you shouldn't, it's not necessarily good to just go to the bathroom, like just in case. Like, I know when I was a kid, that was the thing. Like, if we're about to get in the car, okay, we're going to go to the bathroom. We're going to try to go just in case. And it's like that kind of doing that constantly kind of sets you up for failure.
Pretty much. Yeah. No, I understand, like
with kids,
with kids, or say you're about to get in the car and you have a 4-hour drive to the beach. Okay. Yeah. Go to the bathroom just in case. But it's those instances where, okay, you're going out for the day running errands, and you're like, okay, I walk into Target, let me go to the bathroom just in case. Oh, I walk into Harris Teeter, let me go to the bathroom just in case. Because essentially what you're doing is you're lowering that threshold.
Yeah.
Normally, you should be able to go to the bathroom about every 2 to 4 hours.
Okay.
But if you're going every hour just in case, now you taught your bladder, hey, I can't go more than an hour, so it's going to increase that urgency, that frequency.
That makes sense.
And make it worse.
Well, and on the totally opposite end of it, I'm guilty of this, where you get so into doing something that you hold it for way too long, which is also bad. So what's the like middle ground? How do you kind of know? Like, I guess just listening to your body for the most part.
Yeah. And a lot of times, we'll have women do what's called a bladder diary, because, we're busy, that we can't sit there and be able to pinpoint exactly what's causing, our leakage, our urgency, or this, that, or the other. So you can do what's called a bladder diary, meaning like for a couple days, just write down everything you drink, or every time you go to the bathroom. And then just those couple days of information may show you things that you didn't realize, like, oh, I actually drink 40 ounces of Diet Coke, and I thought I only drank, 15. Or it may show you, hey, I'm actually pushing out every 7 hours. Maybe I should go to the bathroom sooner and just improve bladder habits that way.
Oh, and I know like things like alcohol definitely affect those things too. And what are your thoughts on drinking water right before bed? I've heard both. I've heard like, don't do that, because then you're going to be waking up all night having to pee, but then also you're not drinking anything for 8+ hours while you're sleeping.
Yeah.
And you don't want to be dehydrated.
Yeah. Well, a good general rule of thumb is pretty much whatever you drink, you can expect within the next hour or two, it's going to need to make its way out. So, and that holds true for drinking right before bed. So we generally recommend, stopping fluids at least 2 or 3 hours before bedtime. Yeah. So that way it gets a chance to get through your system. You urinate it out, and then you can sleep longer throughout the night.
Nothing worse than having to get up in the middle of the night.
Exactly. And on that note, like with other than water, one thing I wanted to mention is looking at what you're drinking as well. So like you mentioned earlier, things like alcohol or soda, coffee, tea, all those are known bladder irritants. So I
did not know that.
So they can make that urgency and frequency a lot worse.
So now for you, it's a known.
Wow.
Energy drinks, like all of those things, and not just drinks, but also certain foods as well.
Really?
So like spicy foods or really acidic foods can irritate some people. So generally what I say is if it will cause heartburn, it's probably going to irritate your bladder as well.
So other than water, are there any other drinks that are okay?
Now, I'm not saying you have to solely stick to water.
Yeah,
but
I'm like in excess. It's
like me, I'm a Diet Coke fiend. If you took that away from me,
life may not be worth living anymore.
Exactly. So it's just moderation is key, and then recognizing your triggers, and then just modifying your intake based on that.
Yeah. So at what point, and I guess this is different for everybody, but at what point would you recommend that somebody stop waiting and go ahead and reach out for professional help? Because like for me, I'm like not a hypochondriac, but I like to get ahead of things. And I'm like, if I'm feeling anything, I better get it checked out to like nip this in the bud versus waiting way too long and it being like a much longer process of fixing.
Yeah. I think, it's not life-threatening by any means. But
it's life-altering.
But it's life-altering. Absolutely. Absolutely. And I always say, like, if it's affecting your quality of life, get in sooner rather than later. A common misconception is I'm going to have surgery for this. And surgery is not always the answer or an option even. So I think getting in just to at least know what your options are, kind of know some of these behavioral changes, exercises that you can do on the front end, and just be equipped with that information so it doesn't get to a point where now I'm soaking through 4, 5, 6 pads a day. Like, what can I do to stop it? So I think getting in as soon as you recognize, hey, this is starting to affect my quality of life is important.
I think that's a really good way to put it. Like if it's affecting the quality of life, it is time to go get it checked out. So, okay, let's say a patient, it is affecting their quality of life and they're like, okay, I need to go visit Dr. Bastawros. What would that like initial visit look like?
So it's a very comprehensive visit. Not only do we ask about your bladder symptoms, but we also ask about bowel symptoms because that can affect incontinence, especially things like constipation. We ask about pelvic organ prolapse symptoms, or essentially a herniation of the vaginal tissue, because that can also make incontinence symptoms worse. We get a detailed medical history because certain medical conditions like diabetes or sleep apnea or certain blood pressure medications, they can all play a role in incontinence as well. Look into surgical history. We do a deep dive into what are you eating, what are you drinking, what do your bathroom habits look like. So no question is off limits during this appointment. And then we do a pelvic exam to look at the support of the vagina and the bladder, see if there's any structural indication or structural contributions to why you're leaking. Do a urine sample, make sure to rule out infection because that can also contribute to the incontinence. And then we talk about the options based on what your exam shows, and then together use, bringing in your goals and what you're looking for, and then what options we have, and then together we come up with a plan to improve your quality of life.
Yeah, and I would imagine there's like a process. Like if some people are just really don't want surgery, there's other treatment options that you can try first, and then if those just don't work, you could attempt surgery.
Correct. Yeah, I always think of it like it's not a linear algorithm where it's like if this then that. It's here are all of our options. Let's work together to devise a plan that, may be surgical, it may be non-surgical, just kind of depends on what your exam shows us and what your wants are.
Yeah. And do you need a referral from like your regular doctor?
Nope, not for our office.
Okay.
Yeah, so you can call and schedule an appointment. And in my office, we have myself, another urogynecologist, a urologist who will see male patients, and we have 3 nurse practitioners as well. And then we also have pelvic floor physical therapy on site as well.
So I know like sometimes the dermatologist specifically, it can be like months and months of waiting before you can get in there. Is that the case with you guys, or I guess it depends on the timing?
Correct. It depends on the timing.
Yeah.
Yeah.
So we would just go to, where would we go to book an appointment?
Yeah. So you can call our office. It's 336-718-1970.
Okay.
So that will take you to the front desk. Or you can go to our website. You can search Novant Pelvic Health Center here in Winston-Salem. And it has the biography of all of our physicians and nurse practitioners, and then as well as a scheduling link as well.
Awesome. I'm impressed that you know the phone number. I don't know anybody's phone number.
Oh, it took me 7 years to remember it. So
lots of practice. Okay. So last question for you. What is just one message that you would want anybody who's struggling with overactive bladder, any sort of incontinence, to walk away with after listening to this episode?
I just want, women and people in general to know is you do not have to live with it. So many times we are told it's a normal part of aging. It's a normal part of childbirth or getting older or menopause or whatever. But just because it's common doesn't make it normal.
Yeah.
And there are options there, and we can be as aggressive or as conservative as you want. Our overall goal is to improve your quality of life.
That's awesome.
In other words, if there's too much pee, come see me, is what she says.
I love that. We need a billboard that says that.
Tim with the tagline. I like it.
Well, I am a marketing service. So
Dr.
Bastawros, it was so nice to meet you and to learn a little bit more. This was like very informative. I had no idea about so much of this.
We are happy to talk about it. Then I think, like I said, in this age of like digital information, there's a lot of good information out there. There's a lot of bad information out there.
Yep.
It's just something don't be embarrassed about, because we're here to help.
Because obviously you're not alone. There's 100 million people literally struggling with this. So
exactly.
Yeah.
So I appreciate the time talking to me, and thank you for having me.
Yeah. Thanks for coming on. Great job on your very first podcast.
Exactly.
Ready to sign contract now.
I love it. And as always, you can find Forsyth Mags online at forsythmags.com. And we're also on social media at Forsyth Mags. And if you've ever enjoyed one of our episodes, we would love it so much if you would leave us a rating or a review. And that is all we got for today. That's a wrap. Thanks, guys.
Thank you.
The views and opinions stated on this podcast are solely those of the contributors and not necessarily those of our distributors or hosting companies. This podcast is copyrighted and cannot be reproduced without expressed written consent of Forsyth Magazines Incorporated. Ooh, that's a mouthful.